Hello and welcome to an exciting episode of the Pearl Cruise Show. The person over here has inspired many of the nurse leaders in India, and I thought, why not invite ma'am on our show? Today's chat is going to be a very eminent personality, ma'am Shreedevi Balachandran, with more than 4 decades of nursing experience and more than 3 decades of being an academician. We will be talking a lot about her journey today and why she is not in a great relationship with research and other things. So thank you, ma'am, for being on our show.
Thank you, Pearl, for inviting me on the show. It's a proud privilege to know one of my alma mater juniors who's doing well in Birmingham, and I would be glad to share my experience.
Thank you so much, ma'am. So let's begin with our first question then. Our audiences would probably like to know a bit of your journey in nursing and what inspired for you to move from healthcare into academician and falling in love with it.
Okay. I'm from Bombay. I'm born and brought up in Bombay. And when I finished my 12th grade, I honestly went and got an admission in NM College NM College for microbiology because I hadn't heard of nursing. And
Mhm.
then I happened to chance upon somebody saying about nursing, and that was SNDT Women's University. And when I discussed with my father, actually, then once I heard about it, I wanted to go and join Army nursing. But my father was very much against it because that time they thought that, in Army, it was not safe to send girls to Army and that too away from parents.
Right.
So then I happened to walk into SNDT Women's University, and Mrs. Sigamani was our principal. And they had this big, long procedure of aptitude tests and interviews. And it looked so kind of, oh my God. So I had this microbiology ready that in case I didn't get admission to nursing, then I have something to go back because I had even given my original grade sheets to that college.
Right.
But little did I know then that I am a Mumbaikar and I have a right almost to get admission into nursing.
Right.
So actually, the story of nursing began with, I should say, a personal story. If you watch my neck here,
Uh-huh.
you will see that I have a tracheostomy. So
Oh,
around age 8, I happened to have diphtheria. And the diphtheria was so severe that the patch was right up till my throat and I couldn't even make a sound.
ah,
And the fever was beyond a thermometer.
oh my
And
God.
at this point of time, it was late to diagnose. We had family physicians and things like that. But they thought it was parotitis. And
Mm-hmm.
by the time they realized it was diphtheria, there was a taxi strike, and the family doctor took us up till Mahim station, and my father carried me on his shoulders to Kasturba Medical Hospital. And in Kasturba Medical Hospital, all that I remember was immediately they put a green cloth on my head, and they
Mm-hmm.
were doing something gir 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 gir. And when I came out, I realized that all tracheostomy. That time I didn't know this, and for 20 days I was in hospital. And I remember my mother never left my bedside because the doctor even asked her, this I can remember even now, that do you have another child? How come how come your child is so sick? My parents were only 10th grade passed and they came from Kerala, migrated to Bombay. Probably they didn't know the importance of vaccinating children. And it was not intentional, but it happened.
Right.
And the nursing care that I received at that time,
Mm-hmm.
I was tied like a Goliath with my two hands and my two legs onto the cot because they were afraid that the tracheostomy would come out, or
Come
being a
on.
child, I would pull this out.
Mm-hmm.
And they tied me like that, and they put a red rubber tube down my nose, and I can still regurgitate the egg flip that they
Oh.
put down my red rubber tube. I managed to pull it out once, and they were suctioning. And this suctioning, honestly, was, I even tell today to my students, I will hit their fingers if they suction for more than what they can count on 2 or 3 breaths, because it was a terrible experience. Anyway, at the end of 20 days, uh, that time there was only IV ampicillin. I remember I survived with ampicillin and gentamicin. Today, nobody will survive on this
With
antibiotics.
those, I know.
And I was sent home. And this was something that played on my mind a long time. And there were lots of good nurses at that point of time who really cared. And this was something that maybe in my subconscious made me think of nursing. So I came to college, and I remember Dr. Mrs. Sigamani asking, "What do nurses do?" I said, "Give injection." And then started my journey. And honestly, I will make it quick. Till second year, I did not know what I was doing. I didn't know what nursing was. By the time I was in third year and we had to do case studies and we were in the surgical ward of KEM, I realized what nursing meant. And I graduated, but fortunately or unfortunately, there was a scholarship that I was awarded. And I wanted to go to clinical, but I had to do 2 years of college work
Teaching.
because of the scholarship that was given to me. And then I subsequently, at that point of 2 years, I did my master's in sociology. Didn't want to waste my time. I definitely had a plan to do master's. So then after the 2 years, I joined for master's in nursing, and I graduated with cardiothoracic nursing. And my thesis, during those times, thesis was typewritten, not
Yes.
not in, not on a laptop. We paid some
Yeah.
3 rupees per page, and if you made a mistake, you kept typing it all over again. I graduated, and then I decided that I was called to do patient care, and it's not right that I'm staying in a college. I marched into Hinduja Hospital, said I want a job in the clinical side, and they offered me a job called, that time there was an American system there, so there was a job of clinical nurse specialist, and I requested the director nursing there, don't tell anybody that I have a master's in nursing because I want to work in the clinical area. I had my juniors actually who were ward in charges in the ward. So I worked for 1 month in the ward as a staff nurse because this was my first time to deal with being a staff nurse. And then I went to the ICU, and literally for about 3 or 4 months, I worked in the ICU, really looking after patients. And then I was ready actually to move out because for me, learning was quick and it was becoming a little routine. And I did morning, evening, night, and all those things. So
Yeah.
after that, they gave me a clinical nurse educator, means a clinical nurse specialist at the bedside. So I kept doing with Miss Peterson. God bless her. I don't know whether she's there or not. We did orientation, continuing education, as well as on the ward. I even took up the head nurse's role and did everything that needs to be done, from rota to asking for supplies. And I was there for approximately 6 years. I did very well. I had a lot of opportunity to develop my leadership abilities with the person. There was a CEO, so it was a flat system of administration. Gave me a lot of opportunities. I grew so much in that organization that till today, I can always say that anything that I have got in terms of my clinical skills, which are standing me good even today, is because
Yes.
of those 6 strong years of clinical that I did postmasters. And this is something I want everybody to know. The best thing I did to myself as a professional was to give 6 years of time to teach myself. And the story didn't end there because I'm always doubtful of my clinical skills. So after 6 years, I went back to college and I was teaching there, and in 94. And by the time I had my baby as well, so I was teaching second year medical surgical students. And I happened to come across this big poster in 1995 of this PN Berry scholarship in our faculty room. And I said, what is this? Let me look at it. And it said, there's interviews and in Delhi, and if you're selected, you will get this and that. I have been even at that, from that point of time, even till today, I need to know my own value. So I want to go and test something to see if, okay, let me go and see if at least I am fit to get this scholarship. What I will lose is I will not get the scholarship, but at least I will know what's the questions they will ask. What is this interview about? Because they were also having this scholarship was for doctors and nurses, if I remember correctly. So I
Yes.
went to Delhi with this big idea of finding out what this was all about. And it was a big process, but I hit it because you definitely need to have certain skills. And this leadership from my Hinduja and my confidence levels and my ability to say what I think is right is something that got me through. And I got this scholarship. And then it takes time because the scholarship means only they give us the scholarship, then we have to negotiate with the hospital for our objectives. And what we want to do exactly for a year, etc. So it took me time. And then I went 96, 97 to Royal Brompton for a year. And that was another eye opener. That was another clinical, because it was totally what I wanted was, I had cardiothoracic masters, but I
Right.
really didn't know whether I had that latest up to date information to say that I am a cardiothoracic nurse. So I took
Mm-hmm.
this opportunity to go to the clinical. And while in Brompton, I actually made it to Royal Brompton for a long time. I went to Harefield and Uxbridge, where I saw transplants. And literally in the night, they gave me a pager because I said, I want to see a transplant. So they gave me a pager, and there was a patient who had collapsed on the road. And the Dr. Yakub, the man of transplant. I saw him
Yeah.
operating. I
Wow.
few times, few days. I mean, I stayed there to look after heart and lung patients. I worked in the
Mm.
Elizabeth ward of Royal Brompton, and the head nurse there found me very fit, recommended my registration. So I had this registration. So I worked with heart and lung transplant patients. Then I went to Glenfield. That's the first time we saw ECMO in 96,
Mm.
97. It used to be huge tubes around the cot. I mean, I myself was a little bit anxious seeing how do you look
Mm.
after such kind of patients, and they were more done on children at that time. So at the end of 1 year, I came back, and then what that experience did to me was, it's called experiential learning, which means, like, yes, we have seen nursing in India, but you saw nothing like this, or the freedom that nurses had to make decisions on behalf of patients. Like, even in the Elizabeth ward where I first went, the first day itself, the head nurse, her name was Claire, if I remember correctly, told me, Shreedevi, if we don't change, others will
Mm.
force us to change. That was an absolute hit in my brain, which is true. If you don't
Mm.
change, others will force you to change.
Change.
So when I went there, I saw that actually the doctors limited themselves. There was bypass surgeries, etc. They just said to the nurse that from our side, the patient is fit to discharge. So
Mm.
so the patient belonged to the nurse.
Yes.
This was something that I had never seen, which I'm sure you understand. Right?
Yes.
Yes. So the patient belonged to the nurse, and the nurse did everything, like making up, even the, like, transporting the patient home, getting a follow-up advice, organizing the ambulance, even making phone calls to see whether the patient has a drain. I mean, suppose they went away with chest drains, because then they used to do lung volume reduction surgery. That was also new. COPD patients
Mm.
had their
Mm-hmm.
lungs chopped so that it will expand,
Yeah.
and that was new at that point of time. So the patients used to go home with chest tubes, and we nurses followed up patients. This was like so good to me, gave me the idea that nurses can do so much,
So much.
so much, so much, so much. That when I came back, I had decided that I need to do something. It was the
Mm.
defining moment in my life to say that I need to do something to change nursing practice, to empower nurses, and to give patients the real care that they deserve. And when I came back, joined college, then I thought, okay, at least I have an opportunity to tell students what I've seen, what nursing process meant, because when I saw they followed theories of nursing. This is something I never appreciated theories of nursing in masters, and most people don't. I'm sure those
Yes.
who hear me will uh,
I
ring
remember.
with my
Mm.
statement, because it was taught in a manner that we couldn't really get the essence of it, and neither anybody practiced it that we could appreciate what's the meaning of theory.
Right.
So when I came back, I knew, like, each theory, the theory that we had was in Elizabeth was Orem's theory, I think, or I can't exactly remember.
Theorem. Yeah.
Self
Yeah.
care. Then in the
Yeah.
ICUs, they had something called an enabling theory. And they had their sheets, they had standardized care plans, they had assessments, interventions. Even if it's for blood sugar, there were standardized interventions, and then there was space for us to write. And there were evaluations, all based on the theory, literally on the theory that a ward has adopted. And I thought
Mm.
that this is something I have to tell everybody, whomever I meet. So it was a good opportunity to be with the students in. I did to undergraduate students, and I got a chance to teach master students. This is where Elizabeth and Vandana and so many others who are big people now, who are my students in that period, and probably got a little. I mean, they got something more than what others could have given them. And in the meanwhile, salaries were very low in the college, and my desire to change was constant. And there came a call to me, Shreedevi, do you want to take up director of nursing position? There's a position available in Manipal. The person who called me was Dr. Nesa Joseph, and he was the director administrator of my first job in Hinduja. He had gone back to US, and he had come back to Manipal, and he and Mr. Karkera, they were both the team in Hinduja. They remembered me, and Dr. Nesa said, I remember you as somebody who was a go-getter, and you will probably fit my bill. Would you like to come and interview? I was only 36. And again, that same Shreedevi, okay, let me go and see what's there to
See
lose.
what's there.
Somebody is giving you airfare, somebody is giving you a chance to go and interview, and just go and see what's up there for you. I went there for the interview, and I probably, because I had this nice new experience of cardiothoracic nursing for my age, and probably for whatever reason, they found me very suitable. And then I became the first director of nursing of Manipal Hospital. So they were envisioning a team which will make Manipal the best possible. But when we went there, things were not very great. That's why they wanted to make a change. Dr. Ramdas Pai was looking for something to make a change. It looked like I was dealing with 4 hospitals in one hospital, because the neurosurgery people thought they were running their own hospital. They had their
Right.
own uniforms for their nurses. They interviewed their own nurses. The dialysis and the nephro team thought they were running another hospital. They had the same thing. The heart hospital had a different set of uniform. They did their own recruitments. And then this general hospital had its own thing. It was a challenge to
I
bring
can
this
imagine.
together and make it one hospital. Because if you are a director of nursing, and I was also had the charge of the school of nursing. Okay, so it was like a comprehensive position
Right.
offered. So to get all these people and to get the physicians to understand that nursing is something different. It's not like nursing to recruit
Yeah.
nurses and ensure patient care. So please allow me to do what I need to do, and to put the system together and to get everybody onto one platform. One of my biggest challenges. But I made through it. And then then even simple things like changing the uniform, I put them for the first time in a proper trouser and a top, because that looked more professional. I had time convincing my senior head nurses who were there for ages together, that sari was something not very easy to manage in a
Yeah.
bedside care.
Yeah.
And I gave all of them, I learned, I had that patience. Somehow God granted me that I gave them the time, and over time, everybody got into the groove, and we moved forward. I had to set up some infection control team. There was nothing called an infection control team. I joined in 98, 2000. Everybody was reading. If you went to the nursing hostel, there was Manorama and Matrabhumi, and I don't know what all things in these places that people had. And everybody was, not into anything professional. I thought it was high time to put in a staff development. That is the time when UK started recruiting nurses and putting these people into this mode of continuing education, which had to be planned like once in a week, 3 times a day. That means the morning nurses, the afternoon nurses, and the night
Yeah.
nurses got to repeat the same thing by the nurses, for the nurses, of the nurses.
Of the nurses.
Started with 13 nurses, but landed up in 300 nurses leaving to the UK. And most people around in the other hospitals thought that I was crazy, because why would you leave your nurses after training them to this
I'm
kind of?
so much.
Yes.
Yeah.
When I look back and reflect, by the time I was almost in 15 or 16 years, I felt that that's the best thing to do. Honestly, even till today, I believe this. If they left and they saw something good, and if they want to come back, nobody will stop them from coming back to India and contributing on something that they learned. But definitely they would have got more autonomy, more respect. They would have also they are human. They need the money that they need. They are also people who have children and have aspirations for themselves and their families. So as
Right.
long as they left professionally, didn't tell me lies. I used to say, don't kill your mother 6 times a year. Tell me that you want to go for an interview and I will leave you.
Yeah.
But don't
Yeah.
tell lies, don't remain absent, because you're important. You are important
Mm.
for patients. So as long as they did this and they were professional in their behaviors, we never stopped them from going. And that has resulted in that regard and respect that I hold, because I always cared for the nurses. And I believed, I told my management, care for my nurses and they will care for your patients. I guarantee this. If you, for the nurse, if you don't care for the nurses, it's not necessary. I mean, they don't perceive that they need to care for anybody. They will come for your 8-hour shift and take their salary and go. And then I again landed up at a juncture where I had to make a decision. And Sultan Qaboos University landed up in Bangalore. And I took the call because by the time I was saturated, because in a high level position, you get saturated because you're alone on the top and you have a big responsibility at the bottom. And you need to protect this bottom from the top of your. And
Yeah.
I got saturated. And then I made this decision to have a change. And this was a teaching job that I came to. It was the first college bachelor's program in Oman. And they offered me this position. And I had to negotiate because I thought it was my right to negotiate, and nurses need to learn to value themselves and negotiate for what
Yes.
they think is their worth. And I did this and I got a good offer and I joined the first batch of students who were going to clinical in Sultan Qaboos University, and for the first bachelor's program in Oman. And we had to work very hard because there was nothing ready for us then.
Mhm.
And over time, it just grew over me. And today, my first batch students are the dean. My dean is my first batch student. The assistant
Really.
deans are from my first batch student. And just grew over me. And now I've come to a stage, because as anybody can guess, if you have 4 decades of experience, without telling what my age would be, I'm just basking in the glory of my achievement. At some point of time, I would like to retire. So this is sorry I've taken all this time to tell this story.
No, ma'am. What an inspiring story. I didn't even realize it was so long. Now I just look on my ticker here and it's more than 25 minutes. But that was the journey, wasn't it? I mean, and no wonder, people like Captain Usha Banerjee and all tell me that you're the role model. And I see that there is a similar story shared by all the nurse leaders where they're curious about things, sometimes to validate themselves, sometimes to show to the world what nursing is all about. And everybody, because of that curiosity, because of trying to do something new every time and advocating for nurses, and that's the common story I see, with well established nurse leaders. There are so many things that you've done. I mean, the story is just so inspiring. And I think today's nurses need to see that, because I think today's time and age, thanks to social media and all, I think people seek immediate gratification. So if they don't get something immediately, they just want to change either their profession sometimes, or want to move to other places, jump from one place to other, which is fair enough. But I think this curiosity of doing something, knowing something, standing for your profession, and like you said, if you don't change, people will force you to change. And I think people should keep that in mind. Changing yourself, going abreast with the trends. In fact, nowadays I even see you putting up some updates on LinkedIn about AI courses and all. After 4 decades, you still feel the need that we should keep abreast with the current technology, and I think that is something the young generation should look at. I mean, uh, I'm just surprised at the entire journey that you've taken. Kudos to you, ma'am. And like I said, no wonder the nurse leaders in India call you as their mentor sometimes, and I'm so glad to hear this firsthand from you. Yes. So whilst I was sort of doing a little bit research on you, I saw that you have like more than 29 or 30 publications in the field of nursing. I was wondering if you would like to highlight on anything more, but I know that you have something more to say about research. Uh, So over to you, ma'am. What's your
Right.
take on this?
Thank you so much. Yes, I do have publications, and some of them are concept papers. Very few of them are original. And this happens to be my story because, for one reason, when I look back, research has not been my strength. Though I have done clinical, I have done administration, I have done teaching, and I am struggling now. But I am doing paper research and trying to publish. However, there are two, three things. One is that I lived in an era where it was typewriting and looking for textbooks, for journal articles in the KM on the topmost shelves, which were the most dusty, finding them and writing things about it. And about not having a quick method to do, probably this played in my subconscious that it was not very easy or it was very time consuming. But unlike when I say this in the same breath, I will say it's not, because just last week or 2 weeks ago, I came to know of scientific trusted AI sites. And now I'm writing some discussion on a paper, and I find it so much more easier to do it. And it's not that the same old story. Secondly,
Mhm.
I find that the teacher and the clinician in me pulls me over to that side and says, Sridevi, you spend your time on this because this teaching and what you are doing for your students is giving you more reward than what you are going to do with publishing papers, because there are tons of paper out there which are not utilized. So for me, I'm more of an evidence-based practitioner, and creating more research which not literally takes 19 years to translate into practice. And I don't see I have a life like this anymore. So I honestly like to be an evidence-based practitioner. I run evidence-based workshops, and I encourage now a college to have this. Yes, I have one paper that I want to talk about, which is also good, which is a good one, which was about in 2014. I published Writing to Learn. We had done a simple study on whether, because here in this country, students do not write. We have 100% multiple choice questions.
Oh,
All our UG exams are like 100% multiple choice. Very rarely we have to convince the students that you must do some writing. So there might be like one list question or one some other question, because they do not have this interest to write. So we did one study this long ago, and what I in the process of the discussion and the paper writing, I understood that learning to write is different and writing to learn is different. Now I'm writing a paper on knowledge of perioperative care. This is the enhanced recovery of cardiac surgery guidelines. Whether the nurses know about this, whether nurses are keeping up to date. The paper is still, I gave it to 4 places for publication. Another reason why I'm not the one that wants to spend time. It's normal for everybody. Those who are listening to me, please don't get disheartened. This is normal. But now I need to I want to use the rest of my life to do something for the new learners. Nothing else
yes,
will talk. You can't use my
absolutely.
words and go and change anything.
That's very true, ma'am. Research is required, but if like you say, the utility has to be there. People have to use it. Evidence practice is a thing of the need of the hour. But yes, if there is adequate utility, then probably I think that's supposed to be the research is something that we all need to
Definitely,
focus on.
definitely.
So ma'am, this is particular question I usually ask academicians, and I thought I
Okay.
should ask this to you also. You've been a nursing director, you've been an academician. Now in India, we have this thing. Many of the times, the nursing directors, feel that they are running a mini nursing college because the nurses, the fresh batch of nurses that join them, the hands-on skill, the clinical skills, sometimes they find a huge gap, between the like Alka ma'am used to put it, between the bench and the bed.
Yeah.
So what they learn is probably not entirely what they're going to practice. So is it similar something that you find in Oman? Do you ever get to know from the hospitals saying that yes, the course has been completed, but they need to sort of bridge the gap between. So do you think there is a gap between what is taught and what is being expected out of novice
Surely.
nurse?
See, one thing we must understand about the curriculum is that whether it is in Oman or in India, a curriculum is only preparing somebody to be a basic novice practitioner. You cannot expect a curriculum to give a hospital a ready-made practitioner where specialized doctors are working after their MD or their DM or their degrees such like that. How can you expect a bachelor's nurse to meet the demand of a surgical or a specialist doctor? So there is definitely, it's not the gap, and hospitals need to understand this. Now, in Oman, since you're asking me specifically to say shortly, when they are employing expatriates, no issue, because they take minimum 4 years experience of the relevant place. If they want ICU nurse, they will have a nurse who's worked in the ICU for 4 years. And then they will only have to bridge those new devices or some new systems of
Yeah.
charting or their way of doing things. And they will give them a mentor and they will get going. It is
Mm.
our graduates who are new. And what happens with them is, because most of the time they're employed in our hospital, we have already shown them the system. There will be definitely gap. So all of them get 3 months mentorship. They get less patients assigned to them. And then
Mm.
somebody is doing this orientation and filling the gap. So it is not necessary. Then in our country, it's very different, because when I studied, there were eight colleges of nursing with bachelors.
Yeah.
Today, if you look, we have 4,500 plus. I have lost count of it. And
Yeah.
so many of them are non-attendants. When you ask me the next question, I'm going to
Mm.
come to it. So I know in Bangalore, when I worked for 6 years, there were colleges that didn't exist, but they gave degrees, they gave registration. And this happened in 2000, exactly at the time I was there. So what do you
Mm.
expect people? How do you expect these people to come and work? There were people who had 4 hours of clinical. That means the day they went and saw a hospital, and then they never
Mm.
saw.
Yeah.
So we have to do this work. The sad part is that nurses then, once they, then what happens is the doctors, everybody takes advantage that these nurses, when they get experience, they move out. So they say,
Mm.
why to pay the nurses? It's like, the chicken and the egg and the chicken.
True, true, ma'am. So
Which
so
came
that,
first?
yeah. Now, like, coming to a very relevant next question. So, what do you think? Like you said, there are, and I've heard the stories also, sadly, from Bangalore. Getting degrees of nursing, never attending college even one day. So, I think that brings us to our next question of what do you think? What kind of reform, do we need in the Indian nursing curriculum back in India to
I love
transform?
this question, because I had given a big feedback to the Nursing and Midwifery Council about the hours. Okay, so let's look at it realistically. The first thing that I want to say is, if we want nurses to even come for nursing, look at our curriculum in India. It is some 6,600 hours, out of which 4,600 hours these students have to do in 4 years in this clinical
Mm.
areas. And the number of assignments are almost like crazy. I should say we
Mm.
did it, but I
Yeah.
really don't think we need to do it. My college here, they get bachelors. My students have passed the NCLEX exams in US. They have done their
Mm.
masters in US, their PhD in US, and we have something like a 2,600 hours curriculum, which includes theory and
Mm.
clinic. So
Oh.
what we do differently here is, we don't teach content.
Mm.
You don't teach somebody nursing care of patient with asthma, then with pneumonia, then with
Mm.
bronchitis, then with bronchiolitis or whatever. We
Mm.
teach them the concept of a respiratory issue. It takes less
Mm.
hours. It gives you the
Mhm.
same result. What we do in India is we cover content, and this is something to stop. Secondly, we need to relook at the 6,600 hours, because then I feel we are using our students as free labor. Honestly, I'm sorry. If you don't want to put this, you can cut it. But we shouldn't be doing this, because in UK, I have studied so many spaces. In UK, see, 2,600 is a little low. In UK, I think they have nearly up to 4,000, but they
Yeah.
don't have 6,600. And
Yeah.
that's a good number. While in the US, you can get a bachelor's if you are a late entry, or you're a senior, entry with an adult with other things. Even in 800 and 1,000 hours, you can get a bachelor's. So it's time
Mm.
for our country to look at what's feasible, what we
Yeah.
should do that's possible to do, and the outcome is still the same. The whole world has outcome. So why are we
Mm.
thinking that if we do only 6,600 hours, will the student be able to become a nurse?
Yeah.
One.
Mm.
Second is this concept based teaching. Third is that realistically make sure that the students have assignments that will help them learn, not just make them push papers. The exam systems. See, the academic freedom I enjoy in Oman, this is why I
Mm.
stayed here. Many times people have asked me, come back to India. See, in
Mm.
the academic freedom, when we say we can decide on what kind of exams we want to give, what kind
Mm-hmm.
of, there are certain rules, like for one course of adult nursing, I will do only 2 in-course exams, one final exam for a theory, and for a clinical in 100 marks I might give them like a focus case presentation, and what to say, for clinical evaluation, and maybe like written exams and clinical exams, and give up the 100 marks. But we can decide, we have flexibility, and this flexibility needs to come into the curriculum. When I say flexibility, I understand there may be a problem that everybody might take advantage of. There should be guidelines. Within that
Yeah.
guidelines, people must be given the freedom. Now simulation we started doing here long ago. In India,
Mm.
simulation is not like, still people are struggling with it. But by the time they start doing simulation, we are into something else. We are into robotics, AR,
Mm.
VR. This is where the world has gone. So simulation is
Yeah.
actually only one small part of everything else that we are trying to do. In India, the colleges are mostly privately run, profit based, and hence not
Mm.
able to focus on what's good for the nursing profession. So in government run colleges, I do not have much idea, but now there are a lot of AIMS, and the government will start another 157 colleges. So this should be the trend, and they should focus on what's up to date. And we have to go off this private colleges just asking for money and giving a degree. And there are many other changes, but these are the major things I would think should
Wow.
happen. And educators themselves must think of what are we producing as an outcome, and why are we not speaking about what is the outcome? We are nurses, we know how to make or produce nurses. We should be
Mm.
allowed to do this.
Mm.
And we need to come to some kind of a consensus. And the major things I'm really upset is this. In the world, I'm telling you, Pearl, look at any curriculum in nursing that says 6,600 hours, and I will withdraw everything that I said.
That's quite insightful, ma'am. Like in India, we will graduate as everything,
Yes.
midwifery and,
You are
pediatric,
a pediatric
psychiatric,
nurse, you can be an
everything,
adult nurse, you can be
anything.
everything.
Yeah, and I saw that difference in UK where the nurse will either graduate as an adult nurse or a pediatric nurse. It's basically what you choose to be. And I think that sort of definitely takes out a lot of stress, and they just focus on what they want to do eventually. And if they want to branch out into something else, then you have bridging programs. You want to branch out from adult nursing to midwifery, yes. And you can do those courses whilst you're working. So yes, that kind of flexibility is required. We have gone through the grind in our colleges, and we really feel very proud about it, and we always advocate saying that nahi itna sab
Mm.
karenge to hi acha nurse banenge. But you're right, there has to be this paradigm shift, there has to be change. Every time I ask somebody, everybody says the nursing packages has to improve, that's when people will take up nursing. But I see a different thought that you have. Yes, packages should improve, that's one thing that people, why they choose certain professions. But yeah, if somebody asks me today, I'm like, you will have to catch a 5:15 local from from your from your house, from your train station to get to the clinical area at 7 o'clock in the morning, work there for 8.5 hours, come back to the college. I mean, there is so much of stress involved there. And if the outcomes are going to remain the same, the way it's practiced in Oman or the way it's practiced in UK, then I think it's high time that we adapt these kind of learnings from various countries. And since the past 10 years, I believe India has made a lot of progress trying to catch up with the developed countries. And I think this is something that we need to look into as well, which will entice, and we need more and more nurses. Currently, many nurses take nursing because they know that the end of
Yes.
4 years and then 2 years after that, they're going to go abroad.
Yes.
That's the only carrot many of our nurses have as
Well,
of
it
now.
was the same thing even then. When my class of 50, there were about
Mm.
10 or 15 of them who had US visa with them in 1980. They came to our class with an US visa, or their families were in US, and they came to do
Mm.
nursing because after 4 years they went to US. So it
Yes.
was, but this is now even worse. But that time we were not, oh, that was the only thing, like people who wanted to go. But
Mm.
now, because I will get to go abroad, and I will have a
Mm.
better future. And the
Yes.
country doesn't mind, which is okay because we are a knowledge economy, I call it.
Yes.
Not,
Yeah.
that's fine. But the attitude will be a big problem.
Mm.
That's sorry.
No, no, no. That's absolutely right, ma'am. There are pros and cons of these things. Like you said, yes, yes, we are a knowledge economy, and people do prefer Indians in many of these countries to come and work for them. Yes, but at the same time, I think we should also start thinking about how do we make use of this knowledge economy for our own country, because we have a dearth of nurses. We have not yet reached the goal of WHO's standard of having met the nurse to patient ratio. So I think there has to be somewhere striking a balance between both these things. So, ma'am, let's come back to your experiences as a teacher. Is there any particular incident in your journey as a teacher that has inspired you tremendously, or that has brought a change in outlook?
No, I don't have any specific student incident to say. I know my strength being that I every day enjoy doing what I do because my students are constantly, I strive for that aha moment. This is what I look for every day. So for a change, many years now I've been teaching critical care, and it's been mentally stressing me many years, every semester, because they cannot think of that critical care semester without Shreedevi. So, but I need a break. So this time I've taken adult one students. That means they're going to clinical for the first time. I'm just dealing with them recently and
Mm,
telling them something about FiO2. They have learned oxygen administration and just
yeah.
related it to 21% oxygen is 21% FiO2. So if I'm giving
Mm,
patient oxygen, it is increasing the FiO2 because they cannot manage. We all can live with 21%. See, this patient cannot live with 21, and how do we know, etc.
mm,
Students' eyes are like this, oh, we never knew or we never thought about this idea. And even anywhere that I teach critical care or even previously, all the while that I've been teaching, I have been encouraged by the people who are kind of, oh, this is a great idea kind of a thing. And that keeps me going every day, every time. Usually because in when I was in SNDT, my ex students will tell you that I only knew that as best, that you need to be strict. Let me tell you honestly, I'm admitting, I used to be strict disciplinary. But when I had my daughter, I grew up with
mm.
her and I realized that this is a different generation. And as I started using Erickson's principles of growth, what is
Open development.
development. And I went with my daughter and I actually changed my approach. And I realized that the age of students that I have is intimacy versus rebellion. And
Mm,
this is what I need to change into. But no, my ex students like Swati and other people, they never complained. They said, Miss, because you were strict, we still remember how you asked us to empty, prime IV fluid. They still remember because at the tip of that one drop, I needed them to stop.
gosh.
Because I was thinking that if they ever to give blood or they were to ever give any medication which was very expensive or like albumin, they cannot afford to waste it. This is what is running. But I was a little more stricter than what I should have been. So I apologize to all my students if anybody is listening to me, that was what I knew best then. But
Mm,
now I have changed from that academician to somebody who is kind and I enjoy doing it. And students, I was explaining nursing process and telling them this is an everyday thing that you do in life. You start a car, you need to know the key, you need to know whether there's petrol, whether there is air in the car, without which your car will not start. It's assessment. So I'm now not specifically thinking. Very rarely students argue with me. I have certain principles of no evaluation is a point where which is always something that is a rub between the teacher and the student. What do?
student.
I give them self evaluation. I give them the evaluation because there's lots of research. I tell them, you mark yourself. You know the criteria. You are
Mm,
adults. By the way, we have adult learning theory. All these are my sociology background, the accreditation principles in our college. So, what is adult learning theory? Nobody needs to be told.
yeah.
So, you do your own evaluation. I will do my job. And if I think if you do a fair job, maybe you will gain better marks from me because I know that you have an insight and you will improve. But if you did a poor job, you will not find somebody worse than me because if you think you're 100%, I know what to do with you.
Yeah, that
Nice things that I enjoy doing, and I have learned over years that anyway we cannot teach everything to everybody. I mean, it's that content concept has to get out because we cannot teach everything. What we can do
yes.
is put them on a track, show them
Mm,
lifelong learning, and like it's like that same old saying: you don't give
mm.
fish to the person, you teach them how to
How to
fish.
fish. Fish.
Now I follow that. and I'm very peaceful and I'm very satisfied. And I think that's the I learned about myself to be a very good teacher. So I'm
Mm.
very different person from the journey I started to now. This is what I want to share about it as being an
Uh,
academician.
No, that's quite a very honest submission, ma'am, and thank you for doing that. And change is required. I even remember Mrs. Joy Kuti, who was my teacher and my principal, and when I worked with her as a lecturer, she used to tell me, and of course she's so senior to me. She used to tell me that, Pearl, we have to imbibe ourselves into the current generation. We can't teach the same way that we used to teach 20, 30 years back. It's a different generation, so we have to move along with them, and that's something coming from a person of that nature. So I totally get it, and I'm so glad to hear this from you as well, that
Yeah,
you've
because
changed
Mrs.
over the
Joykuti
period of
was my first year teacher. She held my hand when I was doing intramuscular injection. She was my thesis guide, and I'm ever indebted to her for being my thesis. And for
yeah.
just want to add one line for my academic and clinical, I have role models. I don't know whether you're coming to any other question. For the reason to go to clinical, I have one another inspiring teacher, Mrs. Prabhakar. She's now retired. God bless her.
Yeah.
She's somewhere. In an MSN class, she told us if everybody is going to sit on a chair and teach, who will bring
Mm,
about change in the clinical? See that one liner that was probably
mm.
she never realized, which would have made a difference. That was her. And that was what hit me. And I said, no, after masters, I forgot to say then, I should go to clinical.
Clinical.
And I must do
Yeah.
something for the clinical. That's where people, educated people are needed. I think teaching everybody will manage. And in the
Yeah.
clinical, for doing excellently well, my other role model is Miss Abanti Gopan. She's very much in Calcutta. Recently, also, I told her for the reason for my being a good clinician and being the person that I want to be in clinicals all the time is you. When I went with master students to BM Birla, she was doing an amazing job, including care plans, making sure that the nurses were doing excellent care for the patients, good nurse-patient ratios. There were so many things she was doing then. She's retired now. I'm sure if
Yes.
she listens to me, she'll be happy because I just recently told her she was congratulating me for something, and I said, "Thank you, Miss, because I have this clinical, that passion for clinical from her."
No, ma'am, in professional journey, we all need role models, isn't it? And they are the ones who inspire us to do, what we continue doing. Yes, that now brings us to our next question, ma'am. And this is something that I ask everybody on the show, because the whole purpose of this show is to make nursing more visible, to bring that honor to nursing, which they rightfully deserve. In your opinion, ma'am, how can we make nursing more visible?
The visibility of nursing starts with me, the nurse. So when I say I am a nurse, the tone, the body language, the posture which I use makes a big difference to the society. So when I say I am a nurse, I should say it with pride. The next visibility comes from our family. My parents, I've always told them, if anybody asks you about me, don't tell them I'm a doctor or I'm something, some story around I'm a teacher, etc. No, tell them that I am a nurse. When my parents start telling that I'm a nurse and that they feel happy that their daughter is a nurse and that they are benefiting or proud about it, it will bring a difference slowly to the society. In my family, my cousin, she's in US now, exactly my mother's elder sister's daughter. She's only 1 year younger than me. She was also an SNDT graduate. So we are two in the family as nurses. My entire family has benefited from this. So many other people. Mom went to Bangalore recently, met somebody. We have a warrior group kind of a thing. There was an
Mhm.
Onam program there. She said, she was telling me, Mole, how many people talked about you? They said that when you were in Manipal, you helped them, and she felt so proud about it. And she said, I don't remember all the people that I helped, but they all asked about it. So this comes from the fact that we need to have pride in our profession, which I always say. Just because I'm wearing a white coat and somebody says, thank you, doctor, I don't have to take it. Oh, it sounds very nice to be thank you, doctor. But I need to tell them, no, and I've done this in Hindu, I've done this in Manipal. I've told them, thank you for the thanks, but I'm a nurse, and as a nurse, I'm educated enough. So because I used to teach my cardiac patients about rehabilitation and
Right.
tell them what they should do post surgery, they used to think somebody who knows should be a doctor.
Mm.
This means what? I don't want to say the rest of it. So
Yes.
then being visible, then we should be knowledgeable, we should be up to date, we should be practitioners who are not just because I have a job and I'm sitting. It can't work like that. So that's the society. Then we need to convey this to our students, our staff. So the fact that I allowed my nurses to kind of, pull themselves and said, learn something, stop reading those magazines, present yourself, you will benefit by talking in front of an audience. Even that is a story. I used to tell my nurses in that continuing education, 1 hour is the class. How you develop them. I told them, all these nurses, you speak for 10 minutes, I promise to speak for 50. You speak for 20, I will do the 40. But I need you to do the 20 minutes. So that they are anxious. I'm saying nothing to be anxious. Yes, I know you will probably not make it. Don't worry, you don't feel like a fool. I will complete the rest.
Mm. So that
So
confidence is required.
yes, giving
Yes.
them the courage, giving the students the courage that they have somebody supporting them and standing next to them. So all this will then you look at the. I mean, there's lots we need in India to have regulatory bodies. We need to stop this non-attendance colleges. We need to unite to make sure that we have some standard operating procedures.
Yes.
And we
Yeah.
don't trouble our students to the point that they hate nursing by the time they graduate. So there is unending. If you ask me, I will not stop. So let me stop here.
No, but I think that's the first two things that you said. Very important, ma'am. To proudly say that I'm a nurse, and for our families to accept. Many a times that's what happens. They some of them are not very happy to tell that, oh, they're a nurse. Why? Because people perceive it in a different way. So and the way you also said, when you talk to the patient and they say thank you, doctor, and to correct them and say that no, I'm a nurse, that changes the perception. Oh, a nurse, very knowledgeable, has own body of knowledge. And I think everybody needs to do that. I remember doing that with my patients as well. I had this anesthetist who went to tell patients about, because I did my post graduation in cardiothoracic nursing as well, and we have been taught in our college that when you pre-operatively have to explain the patient everything. So I did all that and I came out, and then I had this anesthetist who went to the patient and then came back in a couple of minutes. And I said, what happened, Dr. Shetty? You're back here so soon. He said, what do I tell? You told him everything. He's like, हाँ, वो sister Pearl ने बता दिया. So, it's so important to make them understand and to share with them our knowledge, to tell them that we are equal professionals with our own body of knowledge, with our independent way of practicing. And that's how, probably that's one biggest way that visibility can be created. So thank you for sharing that thoughts with us, ma'am. So we move on to our next section called as a rapid fire. Some questions that I'll be shooting across to you, and
Sure.
whatever comes to your mind, ma'am,
Sure.
you can probably say that in one word. Right. So here we go. Question number one. Shreedevi as a principal or Shreedevi as a nursing director?
Director of nursing any day.
Oh, that's awesome. I thought you'll be like, oh, principal with the director sort of a thing, but I'm so happy that you've chosen one thing. One piece of advice for nursing academicians.
Be the guide by the side and not a sage on the stage.
Quite insightful. That is very true. So how quite wise that statement is. One message to entice next generation to take up nursing as a profession.
Best thing that I have done in my life is being a nurse, and I would want to be a nurse if I am reborn. And being a nurse means being somebody who's blessed and who made. So
Yeah,
I would be reborn as a nurse. I would be most
I agree with that, ma'am. One big quality every nurse, either academician or clinician, should possess.
role modeling. Be a role model. Walk the talk.
Walk the talk. Yes, very, very important. Walk the talk. And one thing you would do if you had the power to change something in nursing.
Give nurses the autonomy, the respect, and the money that they truly deserve, which says it all: the independence and the respect they truly deserve, because they contribute more than anybody else. Doesn't matter how big qualifications others have. No organization or no hospital or no patient care can happen without a nurse.
That's very true, ma'am. And one motivational quote that inspires you to continue your journey with such enthusiasm, which is displayed so
Can I
well
say
here.
a little? It might be a few lines. If you
Mhm.
can't be a pine on the top of the hill, this is a poem
Mm.
by Douglas Mallock. Be a scrub in the valley, but be the best little scrub by the side of the rill. Be a bush if you can't be a tree. If it isn't by the size you win or you fail. Do the best of whatever you are.
Absolutely, ma'am. Do the best of whatever you are. Such a nice thought to be, coming to the end of this show. It's more than an hour that you've been talking, but it has been such a beautiful 1 hour of knowing so many things about this personality and about this person called Shreedevi and what has all gone into making you what you are. And I see you even today. You are I think you almost finished your course in dancing as well. Yeah,
I'm still learning dance.
still
That is
learning.
another thing I wanted to mention. You don't have to put it there. I believe that being a student somewhere makes me a good teacher because I'm grounded in feedback all the time. When my dance teacher tells me this is not how you do it, or you can improve it this way, or this is the
Mm.
perfect way of doing it, I remember what it is to get feedback.
Feedback.
I'm still learning, and learning is lifelong. I just did a course on certification in higher education, teaching and learning in my university, a 35 credit course, graduation in
Mhm.
November. I review, when I said about research, I review for British Medical Journal of Nursing. I review for Sultan Qaboos University. I should keep I should make myself known in those terms that I'm not averse to research. But the time spent on doing those publications take a lot away from my passion of teaching.
I understand, ma'am. Thank you so much, ma'am, for being on our show. And this has been one of the probably most inspiring episodes. Knowing you're 4 decades into nursing, experiencing so many things, and being that person with, quest of knowledge, quest of, getting validated by your own self. And everybody shares a story that probably nursing was not their choice. But somewhere, I always tell this that somewhere God just picks up people and plants them into nursing because they know that they are going to have a very inspiring journey for
Yes.
next generation to be told. So thanks, Itan ma'am, for being on our show. It's been a pleasure having you on my show.
Thank you so much, Pearl, for what you have done. And probably I did get inspired by that you were asking the questions, and it was fun to say something. Some people have been telling me that I must write a book on my experiences.
Yes.
This is faster than that, and I'm glad.
Yes, it is. I started with wanting to write a book, and then I realized in today's day and age, it's probably better to do podcast, and it's faster, like you said. So thank you, ma'am, and all the very best to you in your coming vision and your and like you said, you would like to proceed to retirement. So all the best for that as well. I'm sure you'll not be just retiring just like that. You'll be doing many more things after you retire. So
Well, thank you so much. You are our next generation. And thank you for making a show that probably will do something to some people. Thanks a lot. That has resulted in that regard and respect that I hold. In UK, you could ask anybody from Manipal and they will tell you about me. Because that's the level at which I was happy to do because I always cared for the nurses. I believed, I told my management, care for my nurses and they will care for your patients. I guarantee this. If you don't
absolutely.
care for the nurse, if you don't care for the nurses, it's not necessary. I mean, they don't perceive that they need to care for anybody. They will come for your 8-hour shift and take their salary and go home.
Mm.
Then I again landed up at a juncture where I had to make a decision. And Sultan Qaboos University landed up in Bangalore. Not that I went
Mm.
anywhere. And I heard of it from my seniors like Rebecca, many at that point
Mm.
of time. This university had a good name. They were very happy with this place. Never gone to the Gulf. That has resulted in that regard and respect that I hold. In UK, you could ask anybody from Manipal and they will tell you about me. Because that's the level at which I was happy to do because I always cared for the nurses. I believed, I told my management, care for my nurses and they will care for your patients. I guarantee this. If you don't
Absolutely.
care for the nurse, if you don't care for the nurses, it's not necessary. I mean, they don't perceive that they need to care for anybody. They will come for your 8-hour shift and take their salary and go home.
Mm.
Then I again landed up at a juncture where I had to make a decision. And Sultan Qaboos University landed up in Bangalore. Not that I went
Mm.
anywhere. And I heard of it from my seniors like Rebecca, many at that point
Mm.
of time. This university had a good name. They were very happy with this place. Never gone to the Gulf.